Do you want to get
Yep, we'll get into it.
perfect? Welcome, everybody, to our training about provider collaboration. Two providers, one client, the practice of collaboration. So Kobe and I, um, we have we have developed sort of a model of, you know, and wanted to share a look at real collaboration between the two of us. Me as a mental health therapist, Kobe as a somatic therapist, and how we work with the clients, how we communicate between each other, and how we have a system for really holding the clients together. So
Yeah.
we're really happy you're here. So we're going to have 30 minutes of presentation, and then we'll have 30 minutes of open discussion. So if you have questions, jot them down, and we would love to. We have some, thoughts about discussion too. But yeah, just let we'll have time to discuss at the end here. So.
Yeah. Well, welcome. So we will get into it and just briefly introduce ourselves. So Kelly, you want to start?
Sure. Yeah. Yeah. So my name is Kelly Hersberg. I am a licensed psychotherapist, and my sort of focus is trauma-informed care. So I work with people who experience anxiety and trauma, and people in transition. So like people navigating, divorce, fertility challenges, grief, people who are, and with that, I think a lot of identity stuff comes up. So I use humor and creativity, somatics, and a lot EMDR and IFS mostly in my practice.
Yeah, awesome. So, hello everyone. My name is Cobi Kanadu. I am a licensed somatic practitioner and also educator and speaker too. And in my practice, I focus on trauma-informed care. So everything for me centers on the nervous system, how we regulate it, how we experience the world through that lens. And so it just is the way I move through the world and work with clients these days. So I focus a lot on trauma, complex PTSD, chronic illness, because in 2019 I got diagnosed with lupus. So that really informs my practice too, being able to understand how to set up systems and create communication around just wellness and how we do that for ourselves as well as the people around us who are supporting or in our lives. So it's I love it. I love to see clients blossom and getting to share today too how Kelly and I have come together and merged that shared lens to support our clients.
Yeah.
Well, we're gonna get into it.
Thanks, Kobe.
Yep. So, just giving a little overview. Sorry, I have to move. The, so, we're going to describe the collaborative care model that we have come up with. Then we'll talk about the referral process, and then our provider to provider communication, how Kelly and I work together and stay informed and in touch, and to like what degree we want to do that.
Mhm.
And then some structured frameworks. And then we'll talk about a case study for one of our shared clients. And then that will lead us right into nice discussion. And again, like Kelly said, hoping that you bring your ideas. And we also are curious how other people collaborate, how they think about this process. So all of
Mhm.
it is welcome in the discussion.
Yeah.
Okay.
Well, so Kobe and I met 3 years ago. Actually, Emily West, most of you will know Emily from Self Space. She introduced us, and we hit it off, just sort of like something. I had been interested in the somatics and somatic therapy for a long time. So we started just getting together, and that really started. Um, I started to realize, oh yeah, this is actually something that could be extraordinarily helpful for my clients. So now at this point in our relationship, we've seen over a dozen shared clients together, and now at this point we share seven people, seven shared clients. Um, so we have, when we started, it was I was sending people over, and we weren't doing as much collaboration or as regular contact as we do now. But that sort of has informed us up to this point. So now we're in more regular contact about these clients because we have so many, and we're seeing I'm seeing people weekly for the most part, and Kobe is seeing weekly or biweekly. So, um, Kobe, anything else to add there?
Yeah, I was just thinking we have gotten to this place too because we now have enough of like a data set. I like to think about things as
Yeah.
like, okay, the metrics and data that we can start to see where there's trends and themes and how to hone something in. And it must have been earlier this year when Kelly realized like we were going through and doing a consult because we try to meet like monthly. She goes, "We have a caseload." I go, "Oh, yeah, we do." And then it really because there was so much consistency and also the retention rate, that made a huge difference that we could really see the evolution of a client's experience. And then just over the weekend, last weekend, we started to realize and start to be curious around like, well, how long have the clients been working with Kelly before she came and referred them to me? So, for another discussion, this could be like a 2 or 3 part series. But yeah, so that is just how we have come to see too, like, and can be able to talk about it at this point as well.
Yeah.
Yeah.
Yeah. Thank you.
Uh, okay. So, in our discussions too, and starting to bring this together, something that really came to light was having this overlap of philosophies. So I'll read this quote. You want to have an overlap in philosophies with referral partners to increase the consistency of care. It also helps reduce burnout, share the load, streamline consultation with other providers, and move the needle or collapse time with the client. And I mean, that was just like this light bulb moment and seeing where when your clients start to have this consistency of care with the shared philosophies, like when you start to find your referral network and understand like, okay, what is my value system? What is theirs? And you start to be able to create that ecosystem, which we'll see in just a moment for your clients. It's a beautiful thing. And you'll start to see results just kind of exponentially grow because now they have all these providers supporting them that they're
Mhm.
getting the same kind of messaging, but from a different lens and from a different kind of modality. But again, when you have that core messaging there. So I don't know if you have anything else to say about it, Kelly.
Yeah. Yeah, I just wanted to address the collapse time piece. And what we mean by that, I mean, you kind of spoke to it, but what we mean by that is that it helps to you'll see in the case study that we show that it helps this work helps to and the collaboration of it helps to like re how would we say it, Kobe? Like reduce the time that it takes for clients to kind of start to see a shift.
Yeah. Yeah, that it helps them reach like the therapeutic goals and also bring clarity around it too. Like maybe they
Mhm.
came in starting needing one thing and that is the foundation, but then it starts to evolve because now they have more access and now they have more support and we heal in relationships. So when they can have strong relationships with all their providers, there is something that starts to grow and blossom within them.
Mhm.
Yeah.
Yeah. And then
So
when you're getting that consistency across providers, what and I have found is that, people will come and see me and say, oh yeah, Kobe just said something like that. Um, and then they'll see Kobe and they'll say like, oh yeah, Kelly was just telling me about this. And it's like, yeah, they're kind of getting like, you'll see we have a quote, in a couple of slides, but we think of ourselves as bookends, for the client. Like we're kind of containing them in this way that, especially for these clients who have experienced a lot of trauma, it just can be so they're really held in it.
hmm. And I think about now another shared client of ours. Uh, I have referred her to a chiropractor that actually Kelly introduced me to years ago when we first met. But that chiropractic office is nervous system focused. And so now the client is coming in and not only saying, like, oh, well, Kelly was just talking about and saying the same thing. And it's funny because we might not even have touched base that week about that certain topic, but because we have a similar method and model for supporting clients, it just happens kind of naturally. But now the client is saying, oh, yeah, and now my chiropractor is talking about this. And now it must, be something that is true. So it's neat. And then again, finding your people that you relate to, share a similar philosophy, you're going to eventually meet other people in that similar vein, which is a reason why most all of you are here, because there's a connection there. So, yeah. Okay. So, okay. So this is how the ecosystem forms. And this really came to light to me maybe in February when another client of mine, who actually I referred to Kelly for styling
Yeah.
services,
Yeah.
again, because trauma informed. And seeing, and she's also another client that I referred to the chiropractic office. And so I was like, oh my gosh, and just seeing how much growth she was happening, how much transformation was occurring in just herself, I started to look up and say, oh, okay, her talk therapist is aligned. The somatic therapy we're doing, oh, okay, even the styling with Kelly, that was supportive and trauma informed. The chiropractic office, trauma, nervous system informed. So I was like, whoa, that really just opened up my eyes that not only is the dynamic between talk therapists and somatic therapy strong, but now she's starting to have this ecosystem. And it really came to light to her too, what the difference it is when she also has providers that are um, supporting the value system and the mode of like the needle that she wants to be moving. So when I look at this, it's like here I am in somatic therapy, and I started to understand early on doing this trauma-informed care that talk therapists, mental health professionals were probably my best referral source. So it was getting to understand, okay, what's my skill set that can support them? Why are they a good referral source for me? Understanding their pain points along with like what their clients are dealing with. So I know I'm trauma informed, so I need to find therapists who are also trauma informed. And then it's like, okay, when I look in their bios and start to think about networking and outreach, I look at, okay, do they talk about mindfulness? Do they talk about somatic awareness? Like what the shared values? Do they appreciate collaboration? Is that said in there? And then I have a good sense of, okay, this is a good entry point versus someone who doesn't talk to that or speak to it in their bio. And then from there, building that relationship, then I have my network where it's like, okay, my scope of practice kind of meets its limits, and then I start to refer out. So that's where chiropractic, naturopathic care, other body workers, and maybe clients transition in talk therapy. So then now I have a therapist I can plug them in with that I have a strong relationship with that could be a great support for this part of their therapeutic journey. And then that's where we come into the ecosystem and that starts to form. Yeah. Um, so some of the questions that when I started to develop my networking and thinking about referral sources and who I could best support and their clients, these are some of the questions that I was asking myself to get to that place. So, like what's expertise? What's the client population serving? Identify the limits of your scope of practice, which I think is really important. Like I understand the jump off point, and you get to see that a little bit more clearly when Kelly talks about the general model of how to see yourself in it. But the jump off point of where your limits of your scope of practice meet, and then that's like, okay, who do I need to bring in to support my clients?
Yeah.
Yeah. So um, I'll kind of leave it there, but just and then I'll let Kelly talk about plugging yourself in into this.
Yeah, so when Kobe and I were discussing this model that she had started to see emerge, we were like, where can people see themselves here? You know, where can people start in this system? And also, I want to be kind of clear here that the way that Kobe and I work together is sort of a long-term, like relational model. Like both of us work within the relationship as a source and as a of the healing for people. So that would naturally mean that like the two of us have that too. Um, so this, I think some of us already like I definitely have clients who have, they're psychiatrists. They already have people that are established. So like um this is a little bit different. It's sort of like starting, like our clients are going to have what they already have, but like where can we help? Where can we assist? Where can we put, where can we add? Where can we expand? So with this model, like you see the orange dot is you. So what we're really thinking about is like how can you identify your referral source? Where are referrals coming into you? Like what is that process? And for some of us at Self Space, we sort of have that process like established in some ways, but also, do you have other connections that are sending you people? Do you have primary care docs? Do you have chiropractors? Do you have other healthcare providers who are sending you that you have a relationship with that are sending you clients. Um, and then for me, I put sort of my stuff in here is like I refer out to somatic therapy. I'm getting, I'm thinking about what could be more support for clients and chiropractic. Um, and then also, I tend to refer out to primary care docs or medical providers or like med providers. And then also assessments. I think a lot of my clients up to this point have been wondering about ADHD. So I'll send them referrals for ADHD. And I have a couple of connections for that, people that have plugged in well to my network and my philosophy. But what we're finding is that really then coming into the ecosystem is instead of being siloed into like, okay, your referral source and then you and then like people you're referring to in this sort of linear way, we're looking at it from like a philosophy focused way. So like what is the philosophy here? And for Kobe and I, it's nervous system care and it's trauma informed care. And
Mhm.
then like everything kind of, you know, webs out from there. So then like the person, like we're sort of like, who else is in this philosophy with us? So that's where, like, so you can see in the ecosystem, it's like, okay, talk therapy is a part of this, somatic therapy is a part of this. We've got the medical care. Maybe we're adding in some movements and some community and interest, like where everything's fitting into this model of like, you know, uh, trauma informed care or nervous system centered. Um, and you'll see at the bottom, like the red dot is some questions that we were sort of like thinking about, like how to find what is like the part of the starting point here is what is your philosophy? Where are you coming from? Um, what kind of philosophy is at the heart of your work? And so the questions that Kobe and I were talking about was like, well, what is the driver here? What is your driver? What kind of philosophy do you come from? So what's sort of the heart of what you're trying to do? Is it a systems? Are you coming from more of a systems perspective? Are you what yeah, I can't think of anything else, but we were kind of like trying to, maybe you'll have some ideas when we enter into the discussion. And sort of what's my area of focus? Oh yeah, I have here like system, solution, trauma, like what is your focus? So that's where you can start to see like who are the people I'm connecting with. And sometimes that even just comes out personally. Like Kobe and I hit it off personally too. So we were like, oh, and we have all these shared values. So that really makes it easy for us to connect and collaborate over with these clients. Anything I'm missing here, Kobe?
Uh, no, I think great. Yeah, I would say I agree with all those things and really understanding your client population too. So when we were thinking about systems, it's like, oh, well, someone who's working with someone who's not trauma informed, because that's how Kelly and I, that's our area of focus. Then it's like, okay, systems. So then they're probably needing these type of providers. Oh, then we might see them burgeon out into these type of interests because as people start to heal their trauma, what we're seeing is then, okay, they're starting to choose interests that they can tap into their nervous system and check in. Does this feel aligned? And you see things that aren't aligned start to fall away and that they start to move towards community that supports them as well. So it's not just in providers, it's in their lifestyle, their activities and such.
Yeah.
So again, gotten to really hone that in and understand that about our clients too. So I would say that's another key thing of like, who are your clients? What are their interests? How do they operate? And then you can start to think about, okay, and where do we start to notice change as well? That lets us know like, okay, this is healing or getting resolved for them in that way. So I guess that's the only thing that I would kind of add to.
Yeah, and on that note, I know we want to get into the case study here for the next, I think, couple minutes, but you'll see this in the case study, and it's like it seems like with some of these clients who have been so closed and frozen with like as a result of what they've been through, the ability, the capacity for relationship starts to open up. So in this case study that what we're going to share, this client in particular has. I didn't even realize it in the first, year to two or two that I was working with her, but she had a really hard time making friends and having any kind of relationships. And actually kind of a hard time seeing Cobi consistently, because she just had such a difficult time trusting. So let's get into it.
Do
Let's
it. Okay. So, we'll send like a little follow-up sheet with all these, so that you can start to plug and play and, make this your own too. But these are just some of the main areas we just kind of defined or realized that would help start to see your referral network and
Yeah.
build
And
it into your ecosystem. Oh
oh,
yeah.
sorry, Cobi.
No, go
I
for
thought
it.
you were. But on this, I think that one thing I want to highlight here is just sort of like that where you're identifying where your scope reaches its edge. Like for me, I can do only so many somatic exercises and in talk therapy, so like where I'm reaching my edge is like I need somebody that is more focused on the body work here, and that's where Kobe plugs in so well, and then her focus is so aligned with mine that like it just is a natural fit. It's sort of an extension of the work I'm doing with clients. So will you go to the next slide, Kobe?
Yep.
So
Yep. Yep.
that's where that's where here it says like refer out, stay connected. You don't leave the picture, you expand it. And that's really how we're seeing this is like we're expanding um, for the client at in the benefit for the benefit of the client, and also for the benefit of us too, because then we get a bigger scope of what's happening too. Um,
Mhm.
okay.
Yeah, and I will say that for me, I want the support of
Mhm.
Kelly and other talk therapists. Like I don't, I need them as well. I can't be doing it alone, nor is it the give the client the best possible outcome. So just thinking about like, yeah, coming together and that we are both valued supports and we get to have this Venn diagram of overlap in our care.
Yeah,
Cool. Well, let's get into the case study.
let's get into it. So the client that we're sharing today, her name is DN. That's how we're gonna refer to her. She is a white woman in her 40s. She came to see me in August of 2023, and her sort of presenting issues were depression, like symptoms of depression. So difficulty with taking action, sadness, some work struggles, like really feeling like she wanted to make money and couldn't really figure out how, but really feeling sad, like difficulty with activation or like motivation, I think is what clients usually say. Um, she saw a talk therapist for 15 years, not consistently, but you know, sort of like as needed, I think is what I understood. And her history is she has a history of sexual abuse by her father when she was 8 to 12 years old, so for 4 years when she was a child. She grew up Mormon and left the church when she was in college. And then also she is one of 10 children, and her parents, so she experienced because of that, experienced a lot of like caretaking duties. She was the oldest girl of the family. She experienced like quite a bit of neglect and resentment from her mom. Her mom knew about the abuse and um, resented her for it. And then also a pretty intense poverty. So that's sort of her history. And what kind of teed us up for the referring to Kobe is that she was in the process of being engaged and getting married in the time that she started with me. And she did a psilocybin retreat because she was sort of the end of her rope, if you will. And after that, she really experienced a lot of destabilization. So she realized like I don't have safety in my body. So we started to kind of map into that more. And that was about 9 months after I started seeing her, and I introduced the idea of somatic therapy to her. She saw Kobe for about 8 sessions, Kobe, in 2024.
Yep.
And then this is a client who, like, within the last 6 months, wanted to leave therapy to start doing more somatic care. And I asked her to stay, and she did, and now she's sort of like locked in. Like that was sort of like the key that turned the trust into gear. And then she went back to Kobe, and now has been with Kobe for about, well, four
Yeah,
to
she
six months.
started back in December, and then there was like a little bit of a pause due to scheduling stuff, but that was kind of also with executive functioning that we were seeing start to appear. But now we are consistent, and she's on board and is building the trusting relationship with me too.
Yeah. Yeah, and no, this client sees me weekly and has been very committed to therapy since she started 3 years ago, which is different than before. Um, yeah. Anything else there, Kobe, that I'm missing?
Oh, yeah. But I think something interesting about this when we think about collapsing time and the collaborative care model is Kelly had shared that this client with her talk therapist that she'd seen for 15 years previously, the abuse never surfaced, which um, is understandable, but also kind of like, wow. So this root cause she's never able to address to really get to the results and the outcomes she was wanting to see. But establishing, like when she started to work with Kelly, she opened up in ways that she hadn't ever previously with this therapist. And then adding me in over the last few years, it's like she's finally getting to start to experience and have more access to herself and do things that she hasn't wasn't able to do to the degree in 15 years, but now is seeing that change exponentially grow in the last 3 years. So we're saying like, she 5x'd in many ways her therapeutic outcomes. And that it doesn't mean that like there's still not work to be had, but she's getting to build community. All these things we're seeing in that ecosystem. It's like she's starting to experience now that she has more safety and access on board
Yeah.
with her body.
And I want to note here that, we're not necessarily looking to speed things up, because um, recovery from trauma is a long process. But I think what we're looking to do is to sort of like support the client in different ways so that things can open up differently. Like something that Kobe talks about is like insight alone isn't going to change behavior. So when I'm seeing a client kind of be stuck in things, like there certainly I can be with them in that for a long time, grief or anger or like, kind of, but also I'm thinking about how can we move this? How can we start to complete the cycle of stress that was created, years ago that has been also creating the coping mechanisms that this client has used to survive. So that's where Kobe comes in, is like she can work with the body, and so much of transforming touch is about, working with those early developmental stages, so we have clients who have had, like memories come back from early childhood that we've both been really surprised about. So I just want to say here that it's not about speeding it up necessarily for somebody like, oh, we don't want to 5x everybody's journey, but for those clients who have been stuck over the years, like this seems to be a way that they can start to get some movement. And now DN told me just actually this week, like ever since I started to introduce Kobe, I have more forward movement. I'm feeling different in my body. And it's like, yeah, exactly. Like now I've seen it enough where I'm like, that's why I referred you.
Yeah, and that exact point too is like we have enough clients that we've shared and been able to communicate on this process that we were able to really see like, okay, at what point would you introduce this? At what point would the client even be open? It's like, okay, I want to introduce this. So, yeah, and to Kelly's point, we're not trying to like speed up, but we just want to give them access to the possibility of something different where maybe they hadn't experienced that before. And one of the ways in which that can occur is by having more safety and security within their body and the viscera of their systems that can then allow talk therapy to integrate and metabolize into their system.
Yeah.
Yeah.
I'm also seeing the time right now. And I just want to address like maybe Kobe, you can talk about your part here and maybe take five more minutes, do you think is good?
Yeah.
And then you can transition.
Yep.
Okay, we'll transition to discussion by 9:40 for sure.
Yeah. Yep, we can do that. So when I guess this is kind of a nice transition talking about how supporting clients kind of from my lens and the referral. So um so in receiving that referral, like I have my own process, which then it's like, okay, Kelly tees them up or other talk therapists too, where I can support them in helping to understand okay, at what point might your clients start to seek this? And because they're dealing with trauma and different things that make it hard for them to access their body and have tolerance to deal with the sensations, distress, and that, then it's like, okay, that's where they might see it. So I'm already understanding that process for the provider. And then that helps them to be able to support and share with their clients, like why this might be a good fit, how this can be supportive, and having like a treatment plan laid out. Because again, depending on your value system or your philosophy and how you're working with clients, but trauma informed, they really value having like a plan laid out. They've dealt with a lot of inconsistencies. So to be able to be consistent and know that they can be held is really important. And so on my end, having a treatment plan laid out, being able to talk about that. And now I have enough experience that I can say, for certain, like change will start to occur, and this is what we start to see. These are the outcomes, where that starts to show up. So, and with Kelly, because we have such a high caseload, we established like, okay, how do we want to communicate? What do we want to be sharing? And so for us, that might be week to week where we share little voice notes, just like giving brief little updates. But then we also make a point of meeting once a month to do a big overarching view of our clients. And in that too, we started to see phases of care. Like, where are our clients? How do we talk about this? And that phase that they're in informs how we support them, both from the talk therapy lens and the somatic therapy lens. And it's like, okay, this is what we're going to focus on moving forward. And it's been so helpful. So getting clarity on, okay, our communication process, what works, how in touch do we want to be? So we've sussed that out, and now we're in a rhythm. But it probably took a couple months for us to kind of hone that in, and also recognizing that we both care and want to be in that level of communication. That might not be the case for the providers you refer with. So even establishing that, like, how do you want to communicate? Is this something that you want to be in touch with? Do you get an ROI for your clients? So, yeah, so it will vary for you and who you're referring with, but it's like even being able to have that discussion and you coming with a framework like, hey, I think I've seen this be a supportive model and system for check-in and sharing information. Does this work for you? How, so that you can come to a decision that feels supportive and good and sustainable, right? Like there was a moment in the beginning where we felt like, whoa, okay, maybe we need to like dial this back or hone it
Yeah.
in. But that's great because now it's like we want this to be sustainable and feel like it is enjoyable for us too.
Yeah.
Yeah.
And I think it also to speak to the phases of care and like the stages of change that clients are in, we had these worksheets that we wanted to actually show today, but then we realized, oh, we actually don't have enough time. But helps give us a shared language too. Like where is this client? Is this active grief? Is it in sort of a processing stage? Like, and that helps us to know like Kobe said, like what to introduce or like how to like what we're going to be seeing together, what
Yeah.
to
And I guess I'll say one more thing and then we can move into kind of our discussion is now that we've sort of worked through that, now for me, like working with other talk therapists, I can say, hey, this is what I've seen, this is what I have as frameworks, and being able to bring that into the discussion with other therapists that aren't Kelly. And it's like, oh, okay, this is kind of the model and the
expect.
frameworks that I'm working within, and how I talk about clients and care, and getting to educate the other therapists that I work with around that. And so that can be really helpful too. And something new might emerge from that as well. But that can also be really supportive for the other talk therapists that I'm working with, that it's like, oh, okay, she's understanding and she's really honed in on what she's offering, which then can help me become more aware of what I'm seeing in my clients here. So,
Yeah.
yeah. Anything else you want to say?
Yeah. There's one thing that this I want to also note that this just requires starting. It just requires jumping in because Kobe and I did not know that we were going to develop any of this, and like, certainly this is not required of you. Like this is just what has helped us kind of like dial into and make it easier for us, really, and maybe make it easier for us to talk about it. But I think that we've learned this because we just jumped in and like started doing it, and we're like, oh, actually this is something that like this is actually working. Like I couldn't have predicted that, 15 of my clients would end up contacting Kobe. And now I have a way of talking about it because her and I have talked about it. She's sent me language to use with clients. And this has just come out of like learning about what she does and then also seeing over time how it affects clients. So now I can say, yeah, I know it sounds weird and I don't know how it works either. Kobe knows the science, But like you can try it and you can tell, you can see for yourself. Like there's a lot of consent built in, but also a lot of like now I've seen this work and I can't really explain it, you know, and we can be in the unknown together, you know, but I think that there's really just value to jumping in and seeing.
Yeah, I love that. I appreciate you saying that, Kelly. And yes, this is what's worked for us, and you can take it and keep what makes sense for you and get to develop your own. But this can just be a starting point to think about discussion and how to introduce it if it's something that you're wanting to see and build in your referral relationships.
Yeah. Yeah.
Okay, on that point, or on that note, yeah, I think we kind of already touched on this, where collaboration isn't about doing more, it's about doing the right thing at the right time with the right person. So we were just really wanting to make sure the client is cared for and supported. And we see that it allows us to not have as much burnout and that clients too can be excited about that they're being held in that space, that they're not always having to carry the communication burden between providers.
Yeah.
So, this quote, and then we'll get into discussion. You're not referring out because you failed the client, you're referring out because you know exactly what they need next, and that's like clinical mastery. So, that and that you deepen and build the trust with them too.
Yeah.
Okay. So now we're moving into open discussion. And maybe I'll just say too, like I know this goes till 10, but if we're really in it and people want to stay, then we've allotted like another 10, 15 minutes afterwards. But please know if you have to go at 10, no worries. And you can just sign off at that point. Yeah, so.
Yeah. Yeah. So what are your questions? Like, what are you thinking about? What have you jotted down? What clients come to mind? Like, where are you all at here?
Hi, I'm Liz. Question, I think mainly for you, Kelly, but maybe also Kobe. Like, what language do you use to talk about body work and somatic therapy? I'm a psychotherapist in private practice. I have a ton of trauma clients, and then I don't like not even sure how I would interest like sort of sell this. So, like, I'm curious about that. Thanks.
Yeah, yeah, yeah. That's a great question, Liz. So how I usually talk about it is like when I'm starting to notice that the clients like not like they're experiencing a lot of insight, you know, like we're getting into it and but it's not the behavior change isn't like coming on board, which you know, it isn't always going to happen. So, um, but there's still, and then when I notice there's still a lot of like underlying dysregulation to the system, like especially to the nervous system, I know that Kobe's work down regulates. So so I use sometimes I'm talking about this when, you know, even when I'm introing EMDR, for example. Do you do EMDR? You do, okay. So what Kobe and I have discussed is like this, her work helps metabolize that, like EMDR as well. So what I'll usually say is like, I have some thoughts like when there is in a lot of distress, you know, after like it usually happens like after I've built the relationship for about 9 months is what Kobe and I have been starting to see. Is right around that 6 to 9 month period is when the trust is established enough with me where they're like, okay, yeah, I think like I can trust that this should be something I can check out. And then what I'll do is I'll say like, um, I think what could help here is somatic therapy. Let me tell you a little bit about it. Like, you know, you're experiencing some insight here, but like you want more behavior change, you want more access to yourself and like your own, I don't know, like not wisdom, but I kind of make it a little bit more practical than that. Like you're wanting more movement, you're wanting more, what do I say? How do I say this? You're wanting more like shift, you want more shift. And you've been wanting that for a long time. Like, would you consider somatic therapy? And then I talk about how it addresses development. Like it's from ages, you know, especially like the transforming touch work is from zero, like conception to age 6 typically. So especially if they're experiencing like pre-verbal, like stuff and we're not and they're sometimes they're not even willing to go into EMDR like they're not stable enough to go into EMDR like we're resourcing but they're not ready to do the reprocessing. I'll tell them that Kobe's work can really help the nervous system down regulate and it can help kind of bring down a lot of the stress that they're experiencing and start to have access to the self. So, and then what I'll do is I'll tell them the process. I usually send them some paperwork that Kobe has given me, and then I'll tell them about um, the um, that she usually wants people to experience 4 sessions. So she'll do a consult. And so I find that usually teeing it up for them like that, like this is what you can expect. And then Kobe, when Kobe takes it, she sort of like delivers on that expectation. It can already start to establish the trust. And then when they come back to me, I'll say like, how was it? Did you talk to Kobe? And then I will also, I'm kind of going all over the place here, but I'll also talk about how we can have an ROI and we can have shared care so that they can have like a net of care or like some sort of like support around them so that they don't have to do a lot of like the communication between us. Um, yeah, that's the start of it.
That's really helpful. Thank you.
Oh,
Um,
good. Yeah. Anything else there?
no, not necessarily. I think just this is, referring out is not new, but the thought of referring out for somatic work particularly is new for me. So,
Yeah.
yeah,
Yeah.
thank you.
Yeah.
Oh,
Hi, Brian. I see your hand.
Hi, Kelly. Hi, Cobi.
hi.
Long time listener, first time caller.
Oh, that's great.
I love the holistic golden thread idea that you have there. It's obvious you guys vibe and speak the same language. What challenges do you have that might come about if you're inviting, a third or fourth provider if the client needs that? How do you avoid the idea that there's too many cooks in the kitchen, in other words?
Mm, great question.
Yeah.
Um, I'm reflecting on a shared client that we had where just the dynamic felt like it was having some triangulation. And I don't know if this is gonna fully answer your question, Brian, but I think about like how did Kelly and I kind of work through that of like what's our level of support? How do we want to navigate communication in session, outside of session? Um, and so Kelly sort of shared how she works with clients, but I guess understanding like where your limits are and where you're coming in, being very clear on your lens and your scope. So it's like, okay, I know even when I refer out to body workers, so I have a client now who's going to see a PT and I referred her to a myofascial release practitioner. And it's like, I have that skill set, but now I've gotten very clear on who I'm supporting, how I work. And so I know like even though I could, that's not really my main support or lens that I'm stepping forward with. And so now it gives me the level of comfort and kind of humility to say like, hey, you should go see this person. And even though like in that we're in a similar vein, we're both body workers. It's like I understand what I'm supporting the client to do is like relational. We're building these new structural frameworks, these new neural pathways. Um, and that is needed for their trauma informed care. And also, they would benefit from having this kind of body work. So, uh, I think initially I did think like, oh, well, are they not going to see me? Or these, all the things that can kind of come up as like insecurities. But now because I'm clear and like keep checking back in with that with myself, that helps me kind of discern and not feel like there's too many cooks in the kitchen. Yeah. So I don't know, Kelly, if you have any questions, and also Brian, if that makes sense or answers your question.
I do have some thoughts to this. I was just thinking about barriers in general, Brian. And so I'm gonna address a couple of barriers and then get to your question about like too many cooks in the kitchen. I think one barrier that I see with clients is cost. It's not always easy for clients to be seeing me weekly at my rate and then seeing Kobe weekly at her rate, which actually we have the same rate. So it's like I'm like offering and asking if it would be possible for them to to like amp up their like the like they have to have a certain level of resources and desire, I think, to want to do this. So that does can make it tricky and not everybody is willing to do that. I've had maybe five, Kobe, maybe five clients I've referred over who are still sort of like who haven't gone through, like they've done a consult with Kobe and then they haven't continued. And I will still with them say like, well, when we're in the middle of talk therapy or in the middle of EMDR, I'll say like, this is where somatic therapy could help. Because I've seen now where it does help. It helps with regulation. It helps people come back. I guess we haven't really talked about the benefits or what we've seen with like DN, for example, but now she can tolerate distress so much better. This is a client who like could not have any mess in her house at all. Like anything, she just wants everything to be perfect and beautiful. And this is something that like I think is a lovely sentiment, but it doesn't really play out very well when you can't tolerate any kind of mess, emotionally, physically. So now that she can start to tolerate, she can have conversations that are uncomfortable, So when I start to see like that, I start to talk about somatic therapy with a fair amount of regularity, so that I'm sort of like telling clients like this is where it can help. Like these are the spots where I've seen it work for people. Um, does that always mean that they do it? No. But I think that could be a big barrier. And I think that speaks a little bit to what you were talking about, Liz, with how to tee it up. Um, I have a couple clients who do have a lot of providers. And Kobe and I have discussed this quite a bit. Like we have a client IO who has like a family therapist, an EMDR therapist, a talk therapist, a somatic therapist. She's seeing the chiropractor now. She has a psychiatrist. Like, and these are all people I've tried to get in touch with, and I have talked to most of them. And the way that Kobe and I see it now is that when the client has more and more access to the self, like I can't get everybody on board with this client. And some people are on board, some people aren't. One of her clinicians is in Kansas. Um, but at least I feel really supported by Kobe and by the work we're seeing together and like by the changes we're seeing together. And I think how we're understanding it is that as the client has more access to self, then things that aren't aligned, like Kobe said at the beginning, start to fall away. Like they start to streamline and the client starts to sort of like feel more control over their life and over their decisions. Um, yeah.
Yeah.
Does that answer your question or like do you have any follow-ups?
No, at the end there, when you mentioned someone that has a lot of providers, that's exactly what I was getting at, and I understand. Yeah, thank you.
Yeah. Yeah. Yeah, that's something that, yeah. So we have like a referral network, but we're not everybody's necessarily connected.
Yeah. And sometimes I see with clients too that might be having a lot of providers are trying to do a lot of things at the same time. I won't say like, I don't think you should be seeing all those people at the same time. But what I will say is, okay, we're going to bring, at least from my lens and scope of practice, like you're going to start experiencing more regulation. You will have more clarity on in what proportions, cadence, frequency, who is the best support, you're going to gain more clarity around that. And even if that means them dropping their cadence and frequency, maybe they feel like, oh, they got what they needed from me, but it's been a launching pad for them to go explore other providers. And I see that change. So there's been enough experience now that I can see where they will come to it kind of when they're ready. And we'll say like, oh, okay, I think this person isn't working. And when I see that opening, I can kind of speak to that and say, okay, who would feel better? Or yeah, maybe there is a downsizing of kind of the providers, or let's talk about how we can hone in on who might be a best support for you at this leg in your journey. So yeah, that's how I kind of work with it and see it from that lens too.
Yeah.
Yeah,
Yeah.
perfect. Thank you.
Yeah.
Yeah. It's pretty strategic. Also, I think that this is a good time to mention that the more I talk about this work and the more that Kobe and I sort of dial into what works between us and how it works, like it all starts with trust.
Mhm.
And one of like the sort of like um Rachel, I can't remember if is it our mission statement, like high trust, high quality.
Yeah, part of it. Yeah, high trust, high quality,
Yeah.
a value system.
Yeah, yes. So self-space, a lot of a self-space value system is centered around high trust, high quality, and that's building it on all these levels. So like right away with the intake process, right away with the website, what are you what are the consistency, the availability that we provide. And the more I talk about this, the more I realize like when I look in my client, caseload, the clients who follow through with these recommendations are the clients I have the most trust with, you know, and not all of them. Several of the clients have started with Cobi and then have not been able to actually have not been able to tolerate the work, Cobi, I'm thinking about EG,
Mhm.
and 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 that's okay. Like I really it's really exciting when somebody just tries something, somebody who has been so locked in a pattern of like just trying to experience some safety, tries something different. And so that is something to be celebrated too. And also I'm like, great, you made a decision. Like, this is exciting, like, don't do it. Um, so there's a lot of opportunity here to build trust. And I find that like with the clients who end up moving forward with it are the clients that I have, like I said, the highest level of trust with. So sometimes what I'll do is I'll go through my client list and I will think about and sometimes, with some of my trusted colleagues, like talk through like where am I feeling the trust not there? And that can come in many forms. But I think that's something really significant here is the trust has to be established in there. And I think that my clients really respond to like my level of transparency with what I'm thinking and how I'm thinking about it. And that is building trust with them too. So I think this is probably a bigger conversation on trust, but I find that that is what really tees people up the best to take the recommendation and to trust that I have their best interests.
Yeah. Yeah. And I think about that from my lens, like when I do consults with clients, I ask them like, how long have you been working with your talk therapist? Do you feel like a good established relationship with them? And if I hear that, yep, I really love working with them, they're amazing and that, then I'm like, okay, they have a strong foundation there,
Mhm.
which then allows them to start to build that relationship with me. And I find, again, like the therapist that I'm connecting the most with, like I also have a shared level of trust. There's a certain level of resonance there that I'm like, oh, yeah, we just are speaking the same language. So, and that translates through our clients. So I look at the clients, and even if it's not Kelly referring a client to me, I could see them working with her because also I have that familiarity and relationship with that talk therapist or other provider. And I really believe clients can feel that too, where it's just like, oh yeah, we're all vibing in this space. Yeah, so I want to see like where do they have established trust, and also if they are in transition with providers or starting a whole set of new protocols, then I'll say maybe this is not the right time, but come see me in a couple of months once you've settled with that. Because even though my work is regulating, it can be dysregulating too. And so, too many moving parts starting at the same time is not great. So, I usually like to, uh, or I find that I have the most success with clients when the acute grief has sort of passed and it's like, okay, they've metabolized it. That's usually maybe 2 or 3 months out, maybe even 6 months out. And I have a new client that just started with me, and they're um, they're starting with a new provider. So I'm going to be curious how this goes. But they have a friend who referred them that they have a lot of trust in. So yeah, um, I guess that's how I would speak to that too. Yeah.
Yeah.
Mm.
How do you all do referrals like now? Like how are you already thinking about this? And like, is there a way that you can even just start to think about that differently based on like some of the things we've been talking about? Or maybe not. Maybe you just want to like talk to me about your referral system. I'm curious.
I guess I just think of like I really admire the amount of time you guys have put into building your own relationship of trust, like the trust between the two of you. And I think that's my experience too, is when there's a genuine relationship where I really know and trust this referral source. I know the client picks up on that from me when I talk about them. Like my confidence in the referral, when you have the trust, like you say, with the client, Kelly, that means so much. And Yeah, so it's just really fun to see your friendship and your collaboration, how much you guys have built that over time, then is translating to a client picking up on that. And they can probably feel that when you're talking about each other. Um, and yeah, they just really the relational aspect that's just the through line everywhere with the client, with each other, between the whole ecosystem you're describing. It's a very relational process. And I love that beyond just like, hey, here's a name, go call them. It's such a beautiful invitation into like a sense of community that you guys have already built. Um, and just it feels very strong in that way. It feels really special.
Yeah, thank you for saying that. And I think that like working with Kobe so closely has given me a new appreciation for my work. And I think that, Kobe, I think you would agree with this, but like I think we've been able to reflect to each other how impactful our work has been and what the client is talking about. And then it's sort of like a feedback system then. I'm like, "Oh wow, what I did this way really helped." Or, "Oh wow, this was really impactful to the client." Or, "Oh wow, the client really trusts me." Like it's giving me feedback on my own like way of being in sessions with clients, what I'm saying, what I'm doing. Half the time I don't even know what the client, of course, I don't even know what the client remembers. And I think a lot of us have been through this where the client's like, "Oh, you said this one thing." And I'm like, "Uh-oh, what did I say?" Ah! And then, and then I'm like, "Oh, I said that," like, wow, that's smart, or what, whatever. It's like the client, takes it in whatever way the client takes it in, but it's sort of a scary moment. Like, but Kobe has really been able to give me like some of the confidence to really keep doing what I'm doing with clients. And I think vice versa, Kobe.
Yes, I would completely agree. And it's been really nice. And yeah, also, I just want to say it is 10. So any of you who have to jump off, please do. But if any of you want to stick around, I'm just going to put this up because we're going to end the recording too.
Yeah. Yeah.
Yeah, so thank you so much for coming and sharing this space and time with us. Would love to stay in touch and just hear and keep this discussion going. I think there's a lot of interesting things here. And I know Self Space is a big supporter of connect and collaborating and part of their ethos too. Yeah.
Yeah. Yeah. Thank you for being here. If you have to go, but we're going to stay on for 10 to 15 more minutes just to like chat, answer questions, hear about, how this is landing.
Hmm.
Yeah.
Yeah.